Hello, everyone. My name is Ashley Slight, and I am an associate with Constant Associates, a healthcare security and healthcare preparedness consulting firm based out of Torrance, California. We specialize in doing training, assessments, exercises, plan writing, and all things emergency preparedness, but we really have a public health, health security, and healthcare concentration. And we're here to tell you a little bit about some tips for the CMS Emergency Preparedness Rule, some tips for implementation in regards to the risk assessment, the communication plans, and the policies and procedures portions of those new requirements. I'd also like to introduce my colleague, Christopher Riccardi. Chris, if you want to say a few words.
Greetings. Thank you for the opportunity to present this material to you. I too am an associate with Constant Associates. I lead the healthcare preparedness practice portion of our business, and looking forward to sharing some information with you all.
Thank you, Chris. So for everyone, we'll just do a quick recap of what we aim to accomplish with this webcast. We are going to do a quick review of the rule and offer you some resources in regards to the overall requirements, but really our goal today is to thoroughly and in detail review the risk assessment and the communications plan components of an emergency management program. We'll also make sure throughout the presentation to give you many resources and links to follow along with, so we want to make sure you all walk away with a lot of takeaways. And then we'll also clarify in particular the hazard vulnerability assessment, or HVA component of the risk assessment, as well as some tips for the communication plan. And that should wrap us up for today. So real quickly before we get into the risk assessment piece, if you are curious about the overall emergency preparedness rule, what the requirements are, what the background of the rule is, we have some resources listed here on the slide. The links directly to the Federal Register and the CMS page where the requirements are listed, as well as the interpretive guidelines. We also did a previous webinar with CPCA. It was called The Impending Storm, the CMS Emergency Preparedness Requirements Training and Testing. So for those of you who are curious about the training and testing components, we did a whole separate webinar about that component in particular. You'll see the link right there on the slide to CPCA's website. And then we have a couple of other documents you could take a look at, including Yale New Haven Health System's crosswalk of accreditation and CMS emergency preparedness requirements, as well as some other overall emergency preparedness rules, presentations, and resources. And with that, I will pass it back to my colleague, Chris, to take you all through risk assessment.
So as we delve into risk assessments, I think it would be helpful to at least level the playing field and give some information as to what exactly a risk assessment is. Having that information may be helpful in how you develop and integrate other hazards and vulnerabilities analyses into your risk assessment. And by just saying hazards and vulnerability, I just want to be clear that risk assessment in this term, in this form for the CMS compliance, is also known as a hazard vulnerability analysis. So that said, we'll move on to the next slide and go through a few items. All hazards approach to emergency management is a means of developing programs that can be adapted to any situation that may be taking place within your environment. If it's a mass casualty incident, if you have an all hazards approach, it wouldn't matter if it was due to an earthquake or due to an automobile accident or some other type of an event, but that your processes will be such that you would be able to manage any event, or at least identify that all hazards in the process. There may be some nuances that would have to be adapted to, whether it be infection control issues, utilities, etc. But your overall approach should be basically the same. So that is why this is termed all hazards approach. And so what's a hazard? Hazard is basically anything that has the potential to cause harm to property, environment, and or the folks working with. The risk is probability of that hazard potentially occurring. And you need to consider different types of issues, whether it be natural, human-induced, technological disasters, and you should be prepared for both things happening internally and externally, and having a process to manage both, or all of the above. So this, when you do your risk assessment, not only is this going to focus on your facility, but also on your community. Your facility may have certain risks associated with it, but your facility is located in a community that may have other risks of which you may not be aware. Something to go down that path, there are petroleum pumping stations that run throughout our city here in Torrance that many folks that do business or have businesses in Torrance have no idea that these risks are real and are not too far from their facility. And I say that because as we start to bring in our community partners to develop these hazards and vulnerability analyses or risk assessments, it's important to have these stakeholders at the table, or at least to interact with them to develop a comprehensive risk assessment and or HVA. And as I refer to HVAs, that is our hazard vulnerability analysis. So what types of issues should be addressed? Well, you have natural snowstorms, earthquakes, fire, flood, heat, any act of nature that could cause you harm. Next would be human-induced, whether it be civil unrest, terrorism of any nature. One other thing that and when we get into the technological, we're dealing with power outages, water failures, any of your utilities that may be at risk. And one of the key components here, and I don't want you to just overlook this, but any cyber attack or cyber terrorism that could inflict itself upon your health system, working through with electronic health records, et cetera. So your internal issues should be based around, it could be flooding that takes place in your facility, an active shooter event, a bomb threat, some type of contamination. Maybe you have refineries or chemical plants in your local jurisdiction, hostage situations. There are various topics that could be addressed through that as well. And anything external, any type of mass casualty event, an emergent infectious disease, if this becomes a flu pandemic, or any type of thing that would cause a multitude of folks to present to your facility. So in going through that, let's review some of these local ones. So your local partners probably have already developed some type of HVA or risk assessment for your community. And I say that because maybe your city disaster planners have put together something that's pretty comprehensive that you are not necessarily going to be reinventing the wheel, but adapting that wheel to fit your wagon, so to speak. So as you move down that path, just understand that you are not in this alone, that there are community stakeholders, whether it be the health department, your emergency management folks within the community, your healthcare coalitions, your local hospitals. These are all key stakeholders, your fire departments, police departments. These are folks that have a keen interest in ensuring that you are safe and that you are addressing the same risks and hazards that they are. Don't bypass, you have a threat and hazard identification and or risk assessment or a THIRA. These are also available online, and you may be able to find ones that fit into your zip code and your neighboring jurisdictions as well. So, but use this as a starting point for building your relationships with these folks. This is a way to open that door. They need to evaluate their risk assessments on an annual basis, as do you. So why not open that door now? Could be done over a cup of coffee. Maybe you invite them to any of your committee meetings. They're happy to come on out and visit your facilities. So let's start taking a look at what do these items actually look like. So this is basically a THIRA that goes through your threats and how you would be able to manage it. And it's basically pretty straightforward. Gives you a description, goes through various protocols. You'll see what the hazardous material version of this looks like. Notice that there is a response section, your assessment section, your recovery section. There's infrastructure involved, economic recovery. These are all key components in when you develop your risk assessment as to the impact that this will have on your facility. So this tool that we're looking at right now is one that is more commonly used. This is an older version of a Kaiser model that you'll notice that it has probability of this, how this will happen, the impact on human life, your impact on property, the impact on your business as a whole. Will it interrupt those services? And then to get into the preparedness, your internal response, your external response to these events. These will all be helpful in determining the percentage of risk that you would face from that particular process. So as you begin completing your HBA, what does this look like? Well, you're going to compile data. And you notice that there were some numbers that were involved on that risk assessment, and we'll cover that just a little bit more in just a few minutes. But I just wanted to get into the nuts and bolts of what this looks like. So you do need to note dates, the responders that are involved. Folks, I'm going to tell you if there's any key component to the new CMS guidelines, it's documentation. And I'll say that again, documentation, documentation, documentation. In the healthcare realm, I worked in a hospital for many years, and the adage is that if it's not documented, it didn't happen. So make sure that you capture all of this information via sign-in sheets or whatever that looks like for your particular environment. But you definitely want to note the dates, notification methods, how you activate and if you've activated your command center. And you'll see as one of the newer tools that are out will demonstrate the activations so that this does not become a subjective document, but a very objective compilation of information so that you'll have a better feel that it will alleviate some of the emotional attachment to certain risks and maybe start to identify something that may be more likely.
And if I can add something real quick too there, Chris, one thing that you'll really want to go back to your staff and ask them about previous incidents. I know in healthcare, we have turnover. We have a lot of folks who've been here in different years, different incidents. So I know we definitely want you to go and interview your staff about incidents that, as Chris had said, maybe they weren't documented very well. Maybe they happened a couple years ago before you came in. Chris, how far back do you recommend maybe they go in the initial pulling together of that list?
Well, get your group together. I would go 5 to 10 years, even just to get a little historical content. Not that because these events may have happened in the past. Perhaps you've implemented protocol tools to assuage some of those risks, but at least to identify and get at some historic content into that. Thanks, Ashley. I appreciate that. And that's really good information to bring across and to put into your toolboxes out there, folks. So next we're going to determine the likely risks. What are your local hazards? And again, to get into those previous issues. Determine the probability. Now, this is a relatively simple scale. It's from 0 to 3, 0 being not applicable, 1 being the lowest when we start getting into some of these. But you'll notice that on this document that we'll show you next, that those numbers are inverted. So we'll get into those as to your response and your capabilities of preparedness. So one, you'll determine the severity of each incident, combination of the magnitude, depending on the services impacted, and the mitigation steps that you may have already in place, resources, capabilities. And the next step will be to calculate that risk. And your risk is basically a total of probability times severity will equal your risk. Okay, so now we'll get into this, and as I mentioned earlier, that the newer version of the Kaiser Permanente Hazard Vulnerability Analysis, you'll notice that on this form that there are alerts and activations. So perhaps you put your staff on alert because of an event happening in your community. Okay, that would definitely be documented as an alert, as simple as it may seem. And perhaps you've needed to stand up your command center or just some bringing leadership together to determine a safety huddle as to how you would respond to that. Well, that would be an activation. And those key components will help you to identify what are real risks in your facility. So you'll see that the next step, it gets into the severity, where your human impact, your property impact, and notice that 1 is the lowest here, going to 3, which is the highest, and then moves into the green section on this, which is the preparedness response for internal and external. But those numbers are now, 1 is the highest in terms of how prepared you are in dealing with planning, the time effectiveness and how many resources you may have available to you, and just basically your community mix and how you're going to get assistance from that community. And then in the yellow section will be a tally of that information to give you a percentage of risk to help you identify a little bit closer. So we'll use an active shooter example just to give you an idea as to what these numbers look like, so that we're not just speaking somewhat ambiguously. With the active shooter, the probability that this may happen is moderate. Now, depending on your facility, is that necessarily the case? Not sure, but that's something that you will have to determine in your facility, in your environment. The number of alerts that may have happened, obviously there are 0 for this one, and there are 0 activations. So just to give you an idea of what those numbers look like in the boxes. Okay. Next, we get into the impact. So you can see that what type of human impact would be involved. Well, you see that that would be very high. There would be an incredible amount of issues with the human aspect of this and the people portion of this program. The next would be property impact, and you can see that it may not necessarily do damage to your property, but it will definitely have an impact on your business, which then we get into as a high level number with that. So that'll help balance out the equations at the end of this. And then next we get into your preparedness and the response. And you'll notice that, many of us have been doing a whole lot of planning around active shooter. So maybe that is not necessarily a 2 for your facility, maybe it's a 3, or maybe it is, or that you've done a lot of work around it and it's a 1. Or your internal response, how are you able to mitigate? And then getting into your community and mutual aid. Do you have your police departments involved? Do they help you with your exercises? These are all key components to know how you would function within that. Now, we just use an active shooter as an example. I don't want you to think that this is, that we're filling in the blanks for you. I just want you to see how these numbers work out to the equation as to your percentage of risk.
And one key thing I'll add to Chris's statement here is that, the Kaiser HBA tool does this wonderful job of auto-calculating that last risk, that percentage, based on the numbers that you've put in for the other categories. But, you don't want to get confused with the term risk. If this puts out 29% chance, that doesn't mean that in the world, your hospital or your community clinic or your long-term care facility has a 29% chance of having an active shooter event. This is a risk that's calculated particularly based on these factors, and it's it's a means to an end. It's a way of ranking the incidents so that you know which ones are higher probability in these categories than others, which ones have higher impact, which ones have lower impact. So you don't want to get confused and say, well, we've got a 29% chance of an active shooter event and go and tell that to your executive. That's not exactly what that means. But if you have 2 other incidents, maybe cyber attack is a 45, earthquake is a 65 on your risk assessment, you want to go in and tell your executives, all right, well, we've got these risks in this order based on these factors.
And, Ashley brings up a good point that all of these risk assessments need to be managed up to your hospital executive or your healthcare executive team. They need to understand the risks that you're determining here as well, because you have to remember that you're identifying risks. The reason for that is so that you can put your funding or your resources towards the preparedness for what are the higher ranked risks within your scope, so that you're not preparing for, let's say, a blizzard in San Pedro, California, but that you can start to identify that there's earthquakes and what do we do about seismic bracing, or Is there a need for a generator, et cetera, et cetera? I think you get the gist of where I'm going with this and how that works out. Here are a couple of other risk assessment formats. And again, just because we demonstrated a couple of others does not mean that that is the end-all, be-all. Folks, there's a bunch of different tools out there. Some of them more simplified than others, but all of them achieve the same goal, and that is to identify what are your biggest risks in your facility that you can then put your planning efforts and response efforts, training efforts towards. Okay? And now, how do you incorporate this into your emergency management plan, the emergency operations plan? You need to make sure that if you're addressing these risks, that you do prepare for these risks. You definitely want to ensure that you are planning effectively as well as economically towards those goals. So you may need to add sections to any of your books, whether it be policy, procedure, on how you're going to manage those top 5 to 10 risks. One of the things that we've used, and this was a joint commission tool, and that is to develop a document with the 4 highest risks that you've addressed and write up a separate, just a couple of columns on a table format of what you've done for mitigation, what you've done for response and planning as well, and what your recovery strategies may be in the event of such an event. Doesn't have to be very wordy, but just that you are addressing these tools. It's a great tool.
That is a great tool, and that's a great, just easy to pull out, especially those events you have a lot that are really common, like a power outage.
Absolutely. And when your surveyors show up and you show them that these are the tools, you've given them a synopsis of your efforts on a sheet, and be proud of the work that you do. Now, your emergency plan still needs to be based on an all hazards approach, and by doing so, again, if you're preparing for an influx of patients, does that necessarily mean that they're flu patients or mass casualty incident patients from an earthquake? At this particular moment, it's not relevant. It's just a matter of a mass casualty event. How would you manage that? Again, your all hazards approach to this will be very helpful in the umbrella over your plan. It should contain some type of continuity of operations. How would you recover from an event? Have you triaged which services are more important in your facility to get back online? Like if you're dealing with an electronic health record, you definitely want to make sure we get that back up and running to get you back to normal as soon as possible. Excuse me. Definitely dealing with our vulnerable populations, and depending on your environment, those populations are a little bit different in every location, whether it be socioeconomic or various disabilities that may come into play. Maybe you have many schools, elementary schools in your vicinity that you may need to be prepared for. How would you communicate, your transportation needs, your medical records, and again, reflect the unique needs of your population, and you must develop policies and procedures that are based on the emergency plan. This is not Ashley and I telling you that, but this is CMS mandating things that are in place, which is a nice segue into our policies and procedures. When you start getting into a few of these things, remember that your emergency plan is not necessarily a policy or a procedure. Your plan is your overarching approach, how you would manage through certain things, but it's not prescriptive. It's just an overarching plan of tools that you may have available, things that you would be able to do, but not necessarily the policy. The policy is a formal document listing the rules, regulatory issues, your requirements for the specific tasks related to this operations plan. And you'll see as some of the examples that we'll be putting out there and some that have already been transmitted via webinars past as to what these actually look like. And then the procedure is the exact instructions and steps needed in order to identify the requirements laid out in the policy. So maybe the policy, and I'm just going to use this as an example, is to open that door, okay, is opening the door. So opening the door, you need to turn the handle. You need to step aside, let the door swing past you or swing out. Those are the different types of procedural issues that you can put into a policy. A little example, again, is this is a shelter in place. The incident commander will decide whether or not the facility needs to shelter in place during an incident. And again, that would also be part of your initiation process, your activation process. So these are all intertwining, but to develop strict situations for that. And they would also make the call whether or not the preferred method over evacuation is necessary as opposed to sheltering in place. Situations may warrant that shelter in place include basically severe weather, nuclear events, hazardous material spills. Again, maybe you're near a refinery as we are here, and sheltering in place is something that we're growing a little bit more accustomed to, more so than I care to think about. But the procedures will dictate exactly how the staff and patients would shelter in place, such as a checklist of steps. And with that, I'll turn over the communications aspect, the communications plan aspect to Ashley.
Perfect. Thank you, Chris. So now we've covered risk assessments. We've touched on policies and procedures and your emergency plan. As we said in a previous webinar, we had talked about the training and testing component. The link was earlier in the webinar about that. Now this last final component we're going to discuss is the communications plan. So what are the key components that you need to have in your plan, and what do you need to consider as you go through the process of completing this document? So a couple of things about what's actually required with the communication plan. As with all the other requirements in the CMS Emergency Preparedness Rule, it needs to comply with federal and state laws. It needs to include a system to contact your internal staff as well as your external stakeholders. And the external stakeholders that are specifically mentioned in the CMS Emergency Preparedness Rule are your local, state, federal partners as well as local tribes. So those four categories are especially important that you need to make sure are covered somewhere in your plan. So starting first with internal, you need a system to contact your own staff if there's an incident. But that also includes other, physicians for your patients and other necessary persons. And what we mean by that is things like volunteers, if you have volunteers or vendors as part of your staff, but also family members of patients and visitors, or other staff that are in your facility on a day-to-day basis. Maybe you have a neighboring adjacent facility or something that you correspond with. So you need to make sure there's a system that's comprehensive enough to cover all of those parties and that it's listed and documented in your communication plan. One thing that has been mentioned with the communication plan is whether or not you need to include the actual contact information of all of your staff members, your volunteers, within the communications plan document. So things like phone numbers or emails. You don't necessarily have to put it directly in the communications plan as long as you have it in a database and a resource directory that you can access during a disaster. So your communications plan, it can contain all the contact info, or it can reference a document that exists online maybe or in your own electronic system, with the caveat being you of course need to make sure you can get at that contact information even if you do have a power outage or the internet's not available. You need to have some sort of backup, paper-based system, some other way of getting at that information. So you'll be able to talk with your surveyor about where this information exists and make sure that everyone knows where and how to get it. So that's internal, and then of course you want to make sure that you have your external stakeholders covered. We mentioned tribe, state, federal, but also consider your regional partners, maybe your local agencies, maybe neighboring jurisdictions. If your facility is part of a chain of healthcare organizations, you want to include, maybe you have a regional operations center. You want to make sure that that's incorporated in your plan too. And you want to make sure that you identify who will do the communicating. Who is assigned after an incident has occurred at your facility to actually notify all the staff or to notify your external partners. A common one is to have the public information officer handle the communications with the internal partners, as well as the media and the public, and then maybe have your liaison officer take control of external stakeholders, your local emergency management, your local public health. But people will have different systems, and that's okay as long as you identify who is doing the communicating. And of course, last but not least, have alternate communication systems, have backups. You have to have redundancies in your communication system. So first, we recommend starting with the internal notification procedures. These tend to be the most comprehensive. This also tends to be one of the most important things, so we'd recommend putting this first and foremost in your communications plan. What and how and when are you going to notify your staff when the incident has occurred? You can use phone or notification trees. Some of your facilities may have a text or mass email-based system. If you do have access to that, great. Just include information in your communications plan about how to get access to that, who can log in, who's trained to use it. You may also just use things like overhead page within your facility. You may also use things like
if I may interject, many of your phone systems now have mass paging capabilities within your facility. So from one location, you just press in a couple of keys, whatever that code would be, and then you can mass broadcast throughout each telephone within your facility. And that could be an easy way to get out some messaging quick. But remember that that would not be very discreet, and it would be able to be heard by anyone. But again, those are the tools that and the thought processes that should go into determining your communications plan as well.
Definitely. Thanks, Chris. And one thing you want to make sure with this is a lot of times those types of systems will address your staff that are in the building that are listed in your database, but they may not cover people like volunteers or vendors. But they are specifically mentioned, especially in the training testing component of the CMS rule. And in an incident, you are going to need to notify them as well. So if your volunteer system or your vendors are not included in your, say, mass paging or your text email-based systems, just make sure you have a backup notification system, a phone tree or some sort to address them. We've already talked about being specific about who's responsible for contacting them, what alternate backup methods exist. But you also want to have some sort of internal form. We recommend an electronic and a paper-based version so that you have a backup to make sure that you are still able to communicate information during the incident internally. So this can be things like ICS or Hospital Incident Command System HICS forms. They have a great patient tracking form that you can use. It can also include things like a situation report. With California, the California Department of Public Health has a medical and health situation report that you can fill out. This is a great form to communicate your facility's status and needs to your local partners during an incident. So that can go to your emergency management agency through your local emergency operations center or the medical and health operational area coordinator, or also called the MOOP. So this type of internal notification procedure includes forms for communicating your status and your resource needs to those local partners. It doesn't necessarily only encompass your internal departments and their resource needs. So make sure you've included in your communications plan a couple of these forms, some samples, and make sure your staff have been trained on how to use those.
Ashley makes a good point. You know, part of this communications plan that needs to be identified is making sure that you communicate your communications plan to the person who will be doing the communicating for you in the event. These are crucial components to this process, and make sure that the folks that will be tasked with doing these things are at least aware of their role and maybe even savvy on some of the tools that you'll be using for communicating.
Definitely, that's a great point. And the surveyors that are evaluating this rule, they're going to interview your leadership and your staff to make sure they're aware of what's in the plan. So if no one has seen it and it's sitting on a shelf, the surveyor is going to know. So we'll move right along. Methods of communication we've briefly mentioned, but just a couple listed here to help you all brainstorm. Overhead page, we talked about mass paging or mass notification softwares. Your website's a great notification communication system. Maybe that's where your staff go for information or your patient's family members. But don't forget social media, or if your system has an app that they use. Also, don't forget web-based communication systems you use with your local partners. So if you use ReadyNet or WebEOC, California Health Alert Network, those should go into your communications plan. Note who has login information, who knows how to use it. And just the basics for your backups: radio, satellite phones, TV, door-to-door, and targeted community outreach can be things like a town hall or something like that in the aftermath of a disaster. So just start to think through these backup methods of communication and make sure that they're documented appropriately throughout your plan.
And if I may interject here for a moment as well, as you start getting into your training and testing and disaster exercises, as you are now mandated to do, I would highly encourage you to start doing communication drills, to test these modalities, to test these methods, see what works. Maybe you have a great plan on paper, and when you go to put it into practice, may not necessarily be the most streamlined process, maybe a little cumbersome. Maybe you want to identify another alternate means, and perhaps you can adapt and adopt.
Definitely. That's a great point about communications drills. Communications is always the biggest gap that we see in drills and exercises at every, so not even just healthcare, every facility. So it's always important to keep your staff trained on that. So once you've finished the first section or two in your communications plan, maybe first you hit your internal notification, next you hit how all your methods of communication. Another tip is to then move on to the external agency notification. Create a comprehensive list of the points of contact at all your local partner agencies. That could be public health, EMS, your medical examiner, coroner office. That could be police and fire, as Chris had mentioned, making sure you have your local stations, but also points of contact at the overall agency. Create a worksheet that has the main point of contact, but also get backup points of contact. And try to get more than just one phone number. Get an email address, get a cell phone number. Make sure you have multiple ways of communicating with agencies, because we all know an incident is probably going to happen at 2 o'clock in the morning when so-and-so's not at his desk. So you want to make sure you've got a couple of methods there.
And as you're developing your HBA and you're including your community partners, yes, that's the time to be exchanging business cards.
Definitely.
That's the time to be exchanging contact information, so that you do have a face to a name, and they have the same. Utilize that to your advantage.
Definitely. And if you can, include a section in your communications plan about how you're going to handle patient information that's protected by HIPAA. There may be a situation in a disaster where you'll need to share that type of information with other agencies, or if you're evacuating and transferring patients. So you'll need to have some sort of plan for how to address the sharing of that information in a disaster situation.
Or at least to designate who would make who would have the authority to make the call to be able to, or to give the approval to be able to share that information.
Exactly. And last but not least, I would save the last section of your communications plan to specifically address public messaging, public information, and public messaging. This is so important in a disaster. It often does not get the attention it needs. If you can put together in your communications plan a crisis communications strategy, this will help you so much in preparing for the aftermath of some incident at or that affects your facility. Make sure you have the information, a point of contact or two, for your local JIC, also the Joint Information Center as it's known. This agency is usually set up by public health or EMS specifically to share messaging related to an incident, and it's for your benefit to get in contact with them if they've been activated. You can also identify an internal team. Assign some of your staff members to be a public messaging team, a PIO, a subject matter expert, maybe a media coordinator, maybe someone who typically deals with the family members can be a family information manager. Put that team together beforehand and make sure you have backups for each of those positions. And make sure you have some templates that are pre-prepared for you to use, especially for those top 5 hazards that Chris had talked about that you've identified in your risk assessment. Have some ready press release templates or some language that can go quickly up on your website if there's a power outage or if there's an earthquake. That will help you all the more in that disaster, and it's a great thing to put in appendices in that communications plan. So we will move on and start wrapping up, but just a couple of resources to leave you all with. As you all know, risk assessments, Chris had mentioned, have different formats. There's a couple listed here. CPCA has a toolkit of materials that they will be posting on their website, their emergency preparedness page. They will be very upfront about when these materials are posted. They will let you know. But the materials include a communications plan template that is very comprehensive. They also include a modified Kaiser HVA tool, which is what Chris went through earlier in the presentation. It'll include links to instructions, and it'll walk you through the process. So we highly recommend downloading those materials once they become available. And as Chris had mentioned, there's some other formats listed here if you'd like to take a little bit more information on risk assessment in general and the types of formats you can take a look at. And then for communication plans, in addition to the CPCA one we mentioned, CDC has some wonderful risk communication tools. They have press release templates for almost every type of emergency on their website. Wonderful tool to download and just have in your back pocket or listed in your plan. There's also some toolkits and crisis communication guidelines available here that are wonderful resources. So that's our webcast on risk assessment, policies and procedures, and communications plans. Our contact information is listed here. If you have any additional questions, we are always there to help. And Chris, if there's anything else you want to wrap up with?
I just would like to say thank you for the opportunity to share this information. Do not be overwhelmed by the amount of materials that we went over. This is an a la carte menu to pick and choose certain things that will work for you. There are some things that are prescriptive, such as your policies and procedures and which ones that those need to go through. Those were listed as well. But I think you'll be able to find that if you take this in small bites, it's very manageable. We wish you nothing but the best out there, but again, please feel free to reach out to us if there's anything that we can do to assist you on that journey.
Definitely, and as Chris said, don't be overwhelmed. This will help your facilities immensely by just getting organized and taking advantage of this opportunity. So thank you, everyone, and have a great day.